Hi everybody, I'm Kaveri. I'm a third year medical student in BGS Global Institute of Medical Sciences, Bangalore. This is a small and simple video where I'll be giving you comparative details between two books. The two books that most of the Indian students use for pharmacology. They are Shanbag and Tripathi. I have scored a distinction in pharmacology and I have read from both these books. So I think I'll be able to give you a fair idea between the pluses and minuses of both of these books. Firstly, let's come to the concepts. In Tripathi, concepts are explained beautifully from the receptor level to any level that the subject can go up to. Tripathi has explained everything beautifully. On the other hand, Shanbag gives you a brief explanation of most of the concepts, but they're not in depth. But for the purpose of understanding by reading simpler concepts, it is best. Coming to ease of understanding, Tripathi, because they have given in a very complex format and they have gone to the depth of the subject, it is a little harder for so many people to understand it with one reading. Coming to Shanbag, with one reading, you'll be able to understand most of the concepts. Coming to the time required to read these books, Tripathi, because it is very complex and it goes to the depth of the subject, you will require a lot of time to finish the chapters. In fact, to read 2 or 3 pages, you would require 1 to 1.5 hours. On the other hand, Shanbag, you can finish reading like one chapter in just 1 or 2 hours, and you can easily remember it also. Coming to the number of revisions required, in Tripathi, you ought to give 4 to 5 revisions in order to remember the concepts. On the other hand, in Shanbag, I think fairly with 1 or 2 readings, you can remember like the entire book. Coming to pictorial memory, Tripathi does not give you any flowcharts or line diagrams, whereas Shanbag on the other hand is full of line diagrams. The receptors in the initial ANS chapter has so many line diagrams and flowcharts, and the mechanism of action of each drug is explained so beautifully that you will have a pictorial vision of the pages. If you're someone who likes to read with books which has a lot of images and flowcharts, I think Shanbag will be a go-to book because you can remember it better rather than reading Tripathi, which is like there is nothing, you don't have anything, just the words that are explained in complex format. Coming to mnemonics, Tripathi does not give you any mnemonics. On the other hand, Shanbag fairly gives you a lot of mnemonics which will help you remember so many drugs and so many side effects very easily. So finally, I want to tell you that whichever the book that you want to read, the thing that mostly matters is how much you are able to remember and how effectively you can read it. If you are a very studious person who thinks that you have a lot of time and you can put in a lot of revisions, then go for Tripathi. And there are a lot of people who love reading complex books and they feel extremely happy when they give it so much time and are able to understand from it. Go for Tripathi. If you are someone who likes simpler books and who do not have a lot of time to put into, or who uses some other aids for studying like videos, or if you're taking coaching from Bhatia or DAMS or PrepLadder or Marrow for your PG, they would have cleared your concepts from depth. So you do not have to read complex books again to understand. You can easily read from simpler books like Shanbag for your exam purposes. And one more thing is time. Time is a very important constraint. If you have a year to study, you can go with Tripathi and you can revise with Shanbag before exams. But on the other hand, if you have only 1 or 2 months and you haven't studied thoroughly from a big book because of some of your personal reasons, you can always go with Shanbag, just for exam purposes. Remember that Shanbag is only a preparation manual as they give it in the book itself. So you ought to choose according to the type of person you are. Now, if you just buy a book and don't open it at all, it does not, there is no use of it, right? So you need to always find out what type of person you are and what type of books you're comfortable reading with and choose a book accordingly. Always remember, if your professor has taught you from a complex book very nicely, or if you're using some other aids for studying, or if one of your friends has explained you all the concepts very beautifully, then there is no point in you digging into bigger books and wasting your time. You can always revise with smaller books. The important thing here is how you build up your concept. It does not matter if you build up your concept from a complex book or a simpler book. You need to just build up your concept, and you should be able to use it in your clinical practice, and you should be very happy with what you're doing rather than stressing out. Just because one of your friend is reading from Tripathi or some other complex foreign authored book, it does not mean that you should also do the same thing. Always choose a book that best suits you. And if you have any other points to add to this video, you can always add in the comment section below. Thank you.